Did you know teenagers can get a stress fracture of the low back? Spondylolysis is a stress fracture of the vertebrae in the lumbar spine, and about 95% of them are located right here at L5. In this model, you can see L4, 5, and then here's your sacrum before you get to your pelvis and your SI joint. It's located at this potentially weak part of the bone called the pars interarticularis. It's really the small part between this facet joint and then that facet joint too. It's a common cause of actually chronic low back pain in teenagers and young adults who play specifically sports. This is not something we're worried about in a sedentary kid. It can be just one side, unilateral. It could occur potentially on the other side over here. If it's on both sides, potentially this whole spine can actually shift forward and cause something called spondylolisthesis, which is slippage of the spine, and man, that is just a mouthful. So who usually gets a spondy? It's usually that young, active athlete. They're the adolescent, they're a teenager, and they're playing a lot of sports. But especially these are sports that are doing a lot of backward extension, or maybe there's that rotation. So I think of offensive linemen, I think of dancers, figure skaters, tennis players, sometimes soccer players. Again, extension and rotation, that's the key part. How do you diagnose it? X-ray is actually not very accurate, not very sensitive, so we usually get an MRI. You can also get something called a SPECT CT or a CT scan, which can be very accurate as well. And then, yeah, these kids, they can be tough. So the tendency is you see a young kid, they're hurting, you're like, suck it up, princess, you're fine. But if this kid is having pain for a number of weeks and they're not getting better with appropriate rest and treatment, I would really start thinking about a stress fracture. There was actually one study that showed kids that played active sports and they presented with back pain for more than 4 weeks, they came into a doctor's office, 47% of them had a stress fracture. A little bit different than just an old person like me.